Good afternoon and welcome to the last day of the third annual New Jersey Youth Transitions Conference. My name is April DePietro. I represent Camden County Partnership for Children on behalf of the YTC Planning Committee. And today we have with us Miss Jocelyn from Easterseals, and she'll be presenting on understanding agency with choice. Miss Jocelyn, the floor is yours.
All right. Thank you, April, for that great introduction. Welcome, everybody. My name is Jocelyn Summers, and I am the Operations Manager of Easterseals, New Jersey's Financial Management Services Agency with Choice program. I know it's a bit of a long name, but Financial Management Services is a subsidiary of Easterseals, and we manage and help support the Agency with Choice program. So thank you all for taking the time to come and join us for this Saturday Zoom session. Okay, so Financial Management Services. Easterseals has transitioned the name of the Fiscal Intermediary Services to Financial Management Services. We want to assure all of our participants or people who know the Easterseals name that we are still the same team. We have, the same leadership. We're just under a different name at this point in time. The state of New Jersey has asked us to ensure a clear distinction between the financial management services and our other programs and service lines. The best way for us to do this was to create Financial Management Services. This is a company staffed by and led by the same exact team members that a lot of us who were previously in the Fiscal Intermediary Services know. I know for you guys that's a bit different, but just wanted to give you that bit of background on our organization. So what is agency with choice? This is an example of a co-employment model where the agency is the employer of record and the individual or family member is the managing employer. Financial Management Services is a fiscal intermediary service, and we support the agency with choice program. For some people who don't know what a managing employer is, a managing employer would basically be the parent or guardian, or if the adult with the developmental disability is their own guardian, they would be their own managing employer and basically govern their SDEs or self-directed employees. So we'll get a bit into the role of financial management services and what you can expect from our service line. So we ensure that the self-directed employees complete and pass all pre-employment background checks and drug testing. We also ensure that SDEs complete all applicable DDD mandated training, which I'll show you a bit of later. We also issue payments to the self-directed hires, and we also, ensure that community vendors that you attach to your plan and that you're getting services from are also paid and set up in our service line. We ensure that the appropriate service documentation is submitted by the SDE when applicable, and also the vendor. We keep and house all service documentation and ensure that when you are completing a case note or submitting your timesheet, that you are providing service that aligns with the individualized service plan. We also claim everything back to Medicaid to ensure that it has been done properly and accurately. Choosing agency with choice. The support coordinator will meet with the family to discuss if the agency with choice fee-for-service model is an option for them. Again, this is a self-direction service line where the family or parent or guardian do have a lot of responsibilities to ensure that service is provided to the individual with a developmental disability. They can advise on the 3 different options. So the fiscal intermediary agent, which I'm sure some of you have went to the PPL session earlier today, agency with choice, or if you would like a provider agency. Support coordinators always try to provide all options applicable. We have some really good FAQs on our website, also a side-by-side comparison of the self-directed employee models, and then our per member per month, which we'll get into during this presentation as well. If the individual or family selects agency with choice, the first thing that the support coordinator would want to do is to go to DDD's website and submit a referral so that we could begin the enrollment process, which is entering you into our service line, hiring the staff that you have chosen. Okay, so here's a bit of a look at what you can expect in agency with choice. what the agency's responsibilities are, and then what you as the parent, guardian, or managing employer would be expected, and your responsibilities. So I'm going to go through everything on the agency side first, and then I'll go through what the family can expect. So we ensure that compliance with legal requirements related to employees is completed. We offer support services to enable individuals and their authorized representatives to perform the required manager-related tasks. So we do provide you with support and user guides and documentation so that you could properly manage your self-directed hires. We submit claims to Medicaid for the SDE and vendor services according to the prior authorized plan in the ISP. We pay SDEs and vendors for the most part as well. We withhold and file required state, federal, and local taxes in accordance with labor and tax laws as well. And then we also ensure that SDEs meet all applicable standards and qualifications. So going to the individual or authorized representative's responsibilities, they take an active role in employing the SDE, including but not limited to interviewing candidates, creating job descriptions, determining the SDE's hourly wage, supervising the SDE. They also help to train and ensure that the SDE completes all applicable training set forth by DDD as well. The authorized representative or individual would also work with the support coordinator to develop the ISP plan, train the SDEs, as I said, in accordance with the ISP, approve timesheets, which I know some people are probably like, oh, I have to approve a timesheet. It's really simple. We've actually just rolled out some new technology, which I'm excited to speak with you about. And I'll do that a little bit later. Provide equal employment opportunities to all SDEs, regardless of race, creed, color, national origin, sex, disability, or marital status in all employment decisions, including but not limited to recruitment, hiring, termination, and all other terms and conditions of employment. And then also, you definitely want to be in close contact with your support coordinator because you will be the one to inform them of any changes that you wish to make, whether that be, the consumer has been hospitalized, you need to update your contact information or your address, or even if you wish to, let's say, increase a SDE's hourly rate, or, possibly terminate a staff, or even when you're hiring somebody as well. And then just to continue about the roles and responsibilities of both parties in this co-employment relationship, Easterseals, or agency with choice, maintains liability coverage via workers' compensation insurance. We conduct at least annual individual satisfaction and quality control reviews, which are available to DDD and the general public. So we love feedback here at Agency with Choice. We've been open for about 3 years now. We just opened last year to the public. So we're trying to get a lot of people's feedback on what they experience in the service line, how can we better support them. So, if you enter our service, you'll definitely be getting a lot of emails regarding your satisfaction with us. We also obtain criminal background checks to ensure that the required employment screenings are complete for new and existing SDEs. We also ensure all applicable mandated SDE training requirements are met. We also reimburse for trainings for your staff. So whatever trainings that are applicable that they need to complete within the first 6 months of hiring, we will go ahead and reimburse them once they have met the requirements. We provide SDE training on appropriate service documentation. One of our favorite features that we have definitely is our customer service team. They actually work 7 days a week, varying shifts, to help support our families who maybe work during the day and only have time to speak on the phone during the nighttime, or even if, you just are busy all week and you need somebody to talk to or some assistance with the service line on the weekend. We have reps available and you could talk to them live. And then we also maintain e-copies of all the SDE documentation. And then the last part, that the individual or authorized representative, their roles would be to inform FIAWC if there's any incident or injury so that legitimate claims are processed and employees receive prompt attention to treatment as per workers' comp rules. They also arrange schedules, backup coverage for the SDE's time off, and absence due to illness. We do offer a very nice PTO package, which is determined by the hours worked by the SDE, which is very nice for them. Work with Easterseals to resolve any SDE or employment issues as well. So what would an individual or their family need to know about the Agency with Choice program? There is a monthly administrative fee to participate in the Agency with Choice model called the per member per month. DDD does pay a portion of that monthly fee to help assist the individual with the disability so they don't have to cover the entire cost themselves, but that cost does come out of the individual's budget for the remainder portion of the PMPM. The individual or family is also able to determine the employee's hourly wage, which also helps you to help manage the budget alongside your support coordinator a bit better, because now you have the autonomy to kind of sit there and plan out exactly how many SDEs you will need, what they will be getting paid, and their hours as well. The rate obviously must be deemed reasonable and customary by DDD, which is up to, from minimum wage, which I believe is going up to $15 an hour starting January 1st, up to $25 an hour. If you believe that your self-directed employee that you've hired to work with your loved one or your individual with a developmental disability deserves more because maybe they have a bit more robust responsibilities written in their job description, you can always speak with your support coordinator to get that reasonable and customary rate increased. Obviously, we want to make sure that no one is being paid too much money, so you just want to make sure that the budget can support whatever the hourly rate and then weekly hours that you enter in the plan, which again, your support coordinator will be very helpful during that time. And then all of the employee hourly wages are marked up by 15.01% to cover employer-related taxes and workers' compensation. Employer-sponsored benefits are also available to SDEs working 30 or more hours for financial management services. The health benefits include medical, dental, and vision. We also have paid time off for all of our SDEs based on the number of hours and years that you have worked for our service line. Here's just a quick glance at our per member per month. We have 4 different tiers or options that you can enter into, and we've really tried to break it down for some of the families who, maybe just need a self-directed employee for a few hours a week. They won't be electing in benefits, or they have benefits elsewhere. We've broken it down into hours just to give you guys a bit of help. And also, again, Agency with Choice. We are all about choice here. We're all about options. So we definitely wanted to go ahead and give you a few different tiers that you might fall under. SDE benefits in the Agency with Choice program. So again, these benefits are employer-sponsored health benefits available to the SDEs working 30 or more hours a week. And of course, when they are initially hired, we basically average those out in the first 60 days. And then a benefit package and email notification is sent to your SDE so they can enroll and review the benefit packages that we offer. They will still pay a portion of their benefits, but we, cover the rest, as with any job or employment. Paid time off is offered again based on the number of hours and the years that you work. And I believe for someone who is working, I think we have it on our next slide. Let me not talk too soon. We also offer 6 paid holidays and the ability to participate in our 403B retirement plan for SDEs who meet the criteria. We also have life insurance for the SDEs working 35 hours or more a week, and then also long-term disability as well. Here's a quick look. It's a lot of numbers for our monthly premiums for benefits for your SDEs. Sometimes families just want to kind of get an idea of potentially what their SDEs will be paying per month or per pay period in benefits. So we just wanted to give you a quick look at our various choices we have. Currently, we are with Aetna, but that can always change in the future. And then we also have a vision plan as well as dental. So for your next part, PTO, which again, I believe this kind of sets us apart from a lot of agencies. We do offer PTO program, which replaces the traditional separation of vacation and sick time. We honestly have given the employees the choice and freedom to choose and make that decision on their own. So it comes in as a lump sum into your portal where you'll be able to see your PTO. So if you start your start date to your 5th year, you get about 0.03 earnings per paid hour. That's an annual maximum of 80 hours in a year. We allow our staff to carry over 40 hours into the next year. Let's say you didn't get a chance to use your PTO, you can always roll it over, and then you can also get that 80 hours for the next year. So it beefs it up a bit. And then if you have worked with our organization 5 years or more, you get 0.05 PTO earnings per paid hour, which ends up being 104 hours in a year, about 14 days. And then again, you can carry over 40 hours into that next year. Here is a quick look at our 6 self-paid hired worked holidays or paid holidays. So if your staff does work on the holiday, they will get time and a half for any hours that they have worked. And if they are not working on that holiday, then they'll simply just be able to enter it on their timesheet and still be paid. So again, another one of our benefits that we've really tried to incorporate for the self-directed employees, because we know that they are working very hard to provide services and supports to the individual with the disability. So we think that they deserve, a bit of pat on the back or a little bit of extra pay when there is a holiday. Again, Easterseals will be covering this time and a half. It will not be charged to your budget. These are 6 paid holidays that we give to the SDEs as a gift. So let's get into a bit of hiring a self-directed employee and what that process looks like. So the new hire process is completed by our agency with choice enrollment team. Basically, after 2 business days of you initiating the process with your support coordinator and choosing the agency with choice as your self-directed service line, we will then begin that enrollment process, which of course looks basically similar to being hired for any job. We have an I-9 form that needs to be completed by both the authorized representative and the self-directed employee. We help you create a job description. We've given you basically a template where you can enter in a few items that you would like the self-directed employee to work on with the consumer or to do as their daily job items. We have an employer reference check. There is a hepatitis B form, an SDE status and hourly rate form, which is completed by the authorized representative or the managing employer. And then we also have an enrollment packet, which again will help you create that job description of basically what are the roles and responsibilities for this SDE when they come into my home or bring my loved one out into the community. What exactly will they be working on? Will they transport? Will they, provide medication and things associated with that? The self-directed employee personally will receive an application for 321 forms. That is our online enrollment portal. Well, they'll complete their application, provide identification to be hired by our organization. They will also sign off on a carry check, which is a electronic child and abuse registration information check. They'll be receiving an email. So definitely when you're entering the Agency with Choice program, we have worked to streamline some of our processes, and we have, rolled out new systems that are electronic. So it can make the process of enrolling into our service much easier. There's also a hire right or motor vehicle background check. This is especially important for those self-directed employees who will be providing transportation. We as the agency want to ensure that they are able to provide transportation safely within the state of New Jersey. There's a drug screen. This is a one-time drug screen upon hire. And then also there is a Identigo New Jersey fingerprint form and schedule that they must complete. So in the Agency with Choice program, we do have an option for you to use a support broker. For some families who don't know what a support broker is, that is just basically an extra level of support aside from your support coordinator who can help you really work to utilize your budget and maybe also help you to manage your staff. We have some families who, even though we've tried to make everything electronic and streamline our processes, they're not very good with computers, or maybe they need some additional support. Your support broker is able to do that. We don't offer the service directly at our agency, but I do know there are some support broker agencies within the state that would be helpful. So we do have a form that if you are using a support broker and you do want them to receive notifications and information about our service line, that you would complete upon entering Agency with Choice, and then they'd kind of be a part of our mailing list pertaining to your loved one. Okay, again, we've tried to streamline some of our processes, so we've kind of made completing documentation for the Agency with Choice program a little bit easier and automated with Adobe Sign, and also our new Agency with Choice portal that we have rolled out recently. This will allow families to electronically sign documents that will be automatically sent back to the Agency with Choice team. The Agency with Choice team has worked to streamline this process just so that, we're not sending paper documents through the mail back and forth. Honestly, since COVID, there has been a lot of delays in the mail, and it was, causing some hurdles within our service line. So we just, immediately corrected that. The Adobe Sign process is super easy. The documents are prepared and sent through Adobe Sign by our enrollment team. And then we will also CC the support coordinator and support broker on our documents, just so that if you do need that additional support again, they're able to be there with you. We also can see your documents in our customer service team, and they will also be able to walk you through how to complete Adobe Sign and, basically give you information on the documents that you're signing. You will receive a notification from Adobe Sign, Easterseals, New Jersey, where you'll then open it up and it will literally have a huge yellow arrow telling you where to sign. You will read the document, review it, and then it'll automatically be sent back to us. We can, send you documents through the mail. That is not a problem. We always have that as a secondary option, but we do ask, or we like that people use Adobe Sign. Honestly, I've had so many rave reviews about using the electronic systems because it just makes the process easier. We don't want to put any more burden on anybody. So this is why we've kind of went with using these systems. We also have a new Agency with Choice portal that has been created to really help the families out. And we are pleased to announce that the new technology is going to help really support the families and self-directed employees. In the month of October, we rolled out 2 new systems, which is our Agency with Choice portal and then our timesheet processing website as well, which we'll get into. The Agency with Choice portal has been created to provide anytime access to services and informations families, self-directed employees, and vendors might need to complete their enrollment process or complete a timesheet or a vendor provider voucher. The Agency with Choice portal was designed to house all the consumer's information and streamline the enrollment process by having the agency documents sign in one location. It offers a personalized message service for all the parties, as well to contact the Agency with Choice team directly. I know some people, you could be looking at a document and instead of trying to send an email or give the agency a call, it would be a lot easier just to write your message here and then just wait for us to respond back. So we're trying to provide, levels of support on all home fronts, especially in the customer service department, because we know that entering into a new fiscal intermediary or self-direction service for the first time can be a little overwhelming and challenging. So we've put some things in place to kind of help you guys through that. A few things to remember: for the individual's budget to move to agency with choice and be eligible, there must be at least one SDE service attached to our plan. Just to kind of explain that a bit more, an SDE service is a self-direct service, so that would be you hiring an employee to provide services and support to the individual with a developmental disability. I know there are some families who, send their children to day program, and maybe they don't have a self-directed employee, on their service line, but they have vendor services and they want to enter the program. Unfortunately, at this time, we do not have that option open. You would need to have a self-directed employee attached to your individualized plan, and then you would be able to bring that vendor service over, whether that be horseback riding lessons or art lessons. We have some people doing virtual services currently, just, over the phone. Also, once the agency with choice fiscal intermediary referral is received, then we will go ahead and kind of initiate that enrollment process with the family and then also the SDE. The managing employer is going to complete the initial form, which is our SDE status and hourly rate form, just providing us with the self-directed hires information, so name, phone number, email address, so that we can begin the enrollment and onboarding process. The agency will use this form again to identify all the necessary enrollment documents as well, whether that be if the self-directed hire is going to provide medication, transportation. Then they're also going to work with the support coordinator to come up with the billable rates and then add that SDE to the plan. So before, your plan has been approved by DDD, the agency with choice team will be reviewing the plan just to ensure that it has been completed correctly by the support coordinator and that all rates and hours have been entered appropriately. For the vendor enrollment, the agency with choice program, we don't really approve or deny any vendors. What we do instead is wait until that approved plan is received, and then we will work to go ahead and enroll that vendor into our service. If there's a question on which type of vendor service that is allowed, it is best to contact the support coordinator, just so again, you can make sure that your plan can handle that sort of service. We do have some families who have budgets that allow for horseback riding or even a summer camp. A lot of families like to add on a pool service in the summertime, which is nice, which then your SDE would be able to take your loved one to the pool, and that would be definitely a fun experience for them. Once AWC receives the authorization from the approved plan, we'll then begin our vendor enrollment process, which is done by our community vendor team lead. We have a team for that specifically so that you can get a great and high level of support. This is currently what our vendor enrollment process looks like. Excuse me. Vendors are going to be sent a W-9 electronic funds transfer, vendor request form, and certificate of liability insurance form through Adobe Sign again. We've definitely tried to make that process easier so that they can go ahead and fill out the information, and then they will be sent what is called a vendor payment voucher, which we have a snapshot of on the screen here, so that they are able to then write the services down that they've provided and be reimbursed for the services as well. We also offer transportation, whether that be multiple passenger transportation, single passenger transportation, or self-directed employee transportation. So multiple passenger transportation is meaning 2 or more individuals are being transported by a provider who is already pre-approved by Medicaid and DDD to provide transportation services at a mileage rate of 74 cents a mile. In cases where the agency is transporting a single passenger during an entire trip, the agency can submit a single passenger rate request through the individual support coordinator. A single passenger transportation can be delivered by a community vendor or a DDD approved provider. So that's where things get a little bit different. You can hire your own company, whether, some people use Lyft, some people use car services to transport the individual to day program or even back to the home. And the rate must be submitted to DDD and reviewed for approval, and there can be a different reasonable and customary rate for when SDEs provide transportation services, which is what we'll get into. This would be when your self-directed employee has a different outcome in service indicated on their service detail report, saying that at these points, they will only be providing transportation to the consumer or to the individual, and they will be paid a different reasonable and customary rate. This option is for families who, don't want to couple their self-direction service and transportation under one outcome in service. Instead, they'll break it up into two different parts and potentially, also provide different reasonable and customary rates for self-direction service or community service, and then transportation. Here's a look at the training for our self-directed employees. This is also housed on our Agency with Choice website. So we have the DDD life-threatening emergencies training, DDD Stephen Camino's law, shifting expectations, changing in perception, life experience and services, preventing abuse, neglect, and exploitation lessons 1, 3, 4, 5, and 7, preventing abuse, neglect, and exploitation practicum, which is actually a document that the managing employer and SDE will work together to complete after they've completed the online College of Direct Support trainings. We also have medication modules. This is only for people who are going to be providing medication to the individual on a daily basis. And it's lessons 1 through 4. That will also be followed with an in-person medication practicum where the managing employer will walk the SDE through how to administer the medication and then watch them do it 3 times just to make sure that it's done correctly. We also have a CPR and first aid requirement, which will need to be done within the first 6 months of hire and then every 2 years after that. We also have a specialized training, which is our on-site orientation. Just want to make sure that on the first day that your SD is providing services and supports to your loved one, you have reviewed your home, if they're going to be providing supports within your home, or either maybe some information on the consumer and what they like to do in the community, as well as your service detail report. And you want to make sure that they have reviewed their outcome in service and that they're providing the services according to the plan and what has been written by the support coordinator. Again, the training requirements continued. The SDEs will receive notification from the Agency with Choice team at 90, 60, and 30 days prior to their due date to complete all trainings that are outstanding. Since the staff have 6 months to complete all trainings, besides the medication modules and also the practicum, we try to give them reminders as well as our compliance team, just to make sure that no one goes out of compliance. Support coordinators and the managing employers are also included on that 30-day communication. SDEs who do not and cannot complete trainings by their expected completion date will risk suspension without pay and also interruption of services. There's no retro payment for self-directed staff or agency staff for the period of time they're out of compliance and suspended without pay. Payment will resume once they have completed all the required trainings. So again, we do not want to suspend any self-directed employees. That's really not our goal. We want to make sure that they're getting their trainings done within the first 6 months of working and being hired. But also if they, unfortunately, they do not complete the trainings, we will make sure we take the correct steps. Here's a quick glance at our new electronic timesheet processing system. The Agency with Choice Financial Management Services team offered formal in trainings to kind of review and roll out this new timesheet website over this last month in October. This website has been created to be our primary electronic system designed to streamline the timesheet and support documentation submission process. So honestly, our trainings this month have went extremely well. There was a team of 11 of us who went in person to meet our self-directed employees, our managing employers, and some consumers, where we provided hands-on training on our new timesheet processing system. The system is truly user-friendly. It's very simple and easy. We want to make sure that all of the staff are being paid on time and accurately, and that the family really don't have to do much, but really approve and submit that timesheet on their end. Here's a look at our secondary option. This is our 2-page paper timesheet. We have also, kept our paper option just so that families who are not as tech savvy do have an option as well and can still enter our service line. So when you do convert to the fee-for-service model, there's a case note requirement that is on both of our timesheets. So for this 2-page paper timesheet, it's on the second page. So the first page is going to record the date, time of service, code associated with the service provided. The second page, again, you'll record the date, individualized activity, location, and service documentation. Both pages have to be completed and then also signed by both parties, the self-directed employee and the managing employer. And all timesheets are submitted on a weekly basis by 11:59 on Saturday. Here I'll just give you a bit more information about our Agency with Choice program. We have our Financial Management Services website, and then we have a newsletter that we will be updating and sending out to families accordingly. And then here's a look at our who to contact section, where you can, speak with our director, Tashea Daniels, or myself, Jocelyn Summers, and then also our customer service team as well. Thank you for attending. And if there are any questions, I'll go ahead and take those now.
Thank you so much.
You're welcome.
We do have a couple questions.
Okay.
Do I understand? Can you see the questions in the chat box or no?
I think so. Is it Jill? I think.
Yes. Do you want me to read the questions?
Yeah, that would be good.
Sure, absolutely. So in layman's terms, do I understand that there are 3 options for families? 1, family person does everything, including bureaucracy. 2, Easterseals takes care of bureaucracy business. 3, DDD does everything, nothing is self-directed.
Correct. So when the family does everything and takes care of all bureaucracy, I do know in PPL, I believe you guys have to sign up for your own EIN. I don't want to misspeak, but I believe that is the case because you're technically a self-direction service under your own EIN, so you operate as your own small business. With Easterseals, we have already purchased the EIN for you, which is why we handle all of the paperwork, documentation, and ensuring that your staff is paid accurately on our end. And then DDD, if you're going to an agency, then they would work with DDD to retrieve that budget and then also use it accordingly with the staff that they have already hired themselves. So I always say self-direction is for those families who, they want a little bit more control, they're more involved, and they really want to get into the nitty-gritty of how service is being provided to their loved one. And then also partner with us to ensure that trainings are done correctly, along with any other documentation. We house that on our protected servers. You don't have to worry about it. And then also we do provide, updates and trainings for everybody involved.
So still lots of room for autonomous choices with Agency with Choice.
Yes, that is correct. There is a lot of choice over here.
I actually have a question, if that's okay.
Sure.
And sorry to take it to a place that might be a little bit sad, but it's the reality of the situation. So what if a family wants to do self-direction, but they'll eventually get to an age where they can no longer take care of the individual? Does a family have an option to then utilize other resources and options for their, young adult, if they are eventually unable to continue to provide services and that support?
I completely understand. Sometimes it does, unfortunately, get there. We do have some older families in our service line currently who have, gotten to that age where self-direction, they still love it. They do want to have a hand in the process and what is going on with the staff supporting their loved one, but they also, don't want to do all the paperwork of hiring a self-directed employee themselves. So what I've noticed personally is they will then, have a secondary guardian
Okay.
available, and they'll work with their support coordinator to give that person partial guardianship where they can then eventually take over the self-direction, and kind of assist them through the documentation. We call them managing employer backups.
Okay.
But basically, we still have, mom or dad or the guardian as the primary, but then we also ensure to include that managing employer backup because they're going to be the one taking them through these steps of completing a timesheet, hiring a self-directed employee, maybe some of those difficult conversations if there's any performance concerns with the staff providing supports to your loved one. A few of them actually came to our trainings recently, and they definitely are there to support that family. Some of them do end up being self-directed employees as well. There was one woman who was with the family for 20 years, and she recently just got, secondary guardianship or partial guardianship and has been able to kind of help the family through some of these newer processes that we've recently rolled out.
Excellent. Thank you. I know that, some of the families that the children's system of care work with, it's not the parent that's taking care of the child. In often cases, it's a grandparent or some sort of kinship care. So the age question typically comes up where they're very involved and want to help as much as possible, but the reality that they're going to be around much longer, sadly, isn't necessarily the case. So they always want to make sure that they're planning and preparing for that. So it's good to know that the family does have options and can kind of change the course of, the services being offered to the individual. Thank you so much.
Yeah, no problem. Thank you all for attending.
Yeah, thank you. Okay, so if you have any other questions, please drop it in the chat box, but that concludes the workshop for today. Thank you so much, Ms. Jocelyn, for joining us from Easterseals with Understanding Agency with Choice.
It's been a pleasure, everyone. I hope to be hearing from some of you soon. I'm just gonna, put the who to contact slide up again. Feel free to contact myself or the agency with any questions, comments, or concerns, or if you would like, more information about our program, we are more than happy to help.
Excellent. Thank you so much for your time and for sharing your knowledge today.
Thank you.